Welcome. I'm Cara King, president of the Academy for Surgical Coaching and a minimally invasive gynecologic surgeon at the Cleveland Clinic. What you're about to watch is part of Mastery in Motion, the 2026 Expert Insight series from the Academy for Surgical Coaching. It's a year-long series built around one idea, that surgical excellence is not a destination. It's something you develop intentionally, continuously, throughout a career. Each session in this series takes on a different dimension of that work. Today's conversation is one I think you'll find genuinely useful, whether you're thinking about your own performance, your team, or how you develop surgeons in your program. You don't have to watch these in order. Each one stands on its own. But if you want to go deeper, the full series is available at youtube.com/@surgicalcoaching. You can also visit our website at surgicalcoaching.org, where you can also find all the ways the Academy can support you directly, because that's really what we're here for, not just to talk about surgical coaching, but to make it available to you. If you've been curious about working with a coach, this is a good moment to look into it. If you've ever thought about becoming a coach yourself, our training program can get you there in about 6 hours with CME credit and formal certification. Whatever brought you here today, I hope what you're about to hear gives you something worth taking back to your work. Let's get started.
So welcome to our Expert Insight series. Today, we are going to be talking about the surgeon's operating system. We spent years training our hands for technical skills, but there's so much that goes on behind our hands within the operating room in regard to cognitive things, emotional infrastructure that really shape our performance. So today, I am thrilled to have one of my own personal heroes, Dr. Caprice Greenberg, join us today. She's a surgeon, she's a coach, she is an international leader and has really spent her career creating surgical coaching on a national and international scale. So Caprice, thank you so much for joining us today.
Happy to be here. Good to see you, Cara.
Yeah, you too. All right, so before we dive into things, I'd love to kind of set the foundation of what we're talking about when we refer to the surgeon's operating system. Again, a lot of times we think about our hands and technical things, but in your viewpoint, what is a surgeon's operating system?
Yeah, so I think when we talk about the operating system, we're talking about the ways that we react to the environment around us, right? So, what is it that we think? How do we process information? How do we control our reaction to that information as we're processing it? And then how do we interact again with the environment around us?
So it's outside of ourselves. I'm hearing you say this. I'm hearing you say a lot of system things. And I'm hearing you say that our own personal experiences for sure dictate how we react as well. Yeah, do you see that?
Absolutely.
Yeah. Okay, great. So when we move outside of that, I know you're obviously the chair of the University of North Carolina. You deal with teams in many facets of your life. You've done a lot of coaching. When you're working with your teams, when you're observing different coaching interactions, what are you seeing internally in the surgeons who are showing up to be coached these days, or the leaders, other people you're speaking with on a day-to-day basis?
I think that the most important thing that we've seen has been really an interest in coming up with or having a structured way to look at the ways that we perform, look at the ways that we take care of patients, question some of the assumptions that we have and the ways that we do things, and really working with another person to be able to push our limits and think differently about how we might be able to continue to improve throughout our careers.
Love this. And when you're talking to people, I'm thinking about surgeons, we're perfectionists, yeah, type A type of personalities. Are you seeing people blame themselves for things? Are you seeing people recognize that the system is part of that? What are people's kind of inherent behavior patterns going on right now?
Well, I think it depends a lot on when people trained, right?
Yeah.
So, and some of the generational differences that we have in people that are within our workforce right now. So, I think people that, trained a while ago were very much taught that you are the sole responsibility, you have sole responsibility for everything that happens to your patients, right? And so there's that really core fundamental, this is all on me. And then there's the people that sort of train later who understand that we're one piece of a bigger system that has to interact appropriately. We're an incredibly important part of that system, but we really are dependent on the ways, again, that we interact with all of the people, all of the technology, all the different things around us in order to be able to facilitate that job.
Yeah, man, you're so right. And technology is changing at an incredibly rapid speed. How are you seeing that integrated in the more seasoned surgeons? Are they integrating that well? Are they fighting it? What are you seeing in that area?
Yeah, again, I think it's very individual how people react, right? You have your early adopters that are like gung ho and ready to try anything. And then you have your people
Yeah.
that are incredibly risk averse that have been doing things the same way for 30 years. And how do we get them to change? And I think that's one of the great things about coaching is that it's really one of the first ways that we've had to really provide individual support to somebody based on where they are in their comfort with change, in what they're trying to accomplish, which again is going to be different in terms of how much they've adapted and how far out they are from their training and, all the things that go into sort of the need to individualize when you're working with somebody in changing a practice.
Yeah. I'm thinking of this space of coaching and this space of making the invisible visible. And I feel like even for myself, when I think about getting better in my career, whether it be technical skills or leadership or any of that area, in my mind, I'm like, well, I need to learn more. I need to read more and learn more and practice more. But I feel like the farther we get in our career, you almost have to unlearn things that may have served us before, but are not currently serving us now. Have you experienced that before? Or things in your career that you are working on unlearning or have unlearned?
Yeah, and I think this, what we've been talking about in terms of that constant tension between sort of individual responsibility and systemness, right?
Yeah.
And I think people often think of those as dichotomous and totally in conflict. And I think one of the most important things with coaching is really thinking about how do we integrate so that people see the role that they play, but then again, also are able to tap into that systemness. And for me personally, like this has been a huge struggle. And as I've moved along in my career, it's gotten more and more challenging, right? So again, when you're an intern and you're told you are of ultimate responsibility, right? The mantra where I trained was trust no one, expect sabotage. Right? So so
Yeah.
if, the X-ray didn't get taken, the labs didn't get drawn, even if you put the order in, it's on you that those things didn't happen, right? And
Yeah.
so that is a very isolating, right, approach
Yes.
to responsibility. And it also almost puts you, again, sort of in conflict with the system around you. And I think as the American healthcare system has evolved, it's become so much more connected in the way that we deliver care, right? Multidisciplinary care, it's not even just your hospital anymore, it's your hospital within your broader health system. And how do you interact with all those other pieces? And so, again, it's funny when I was first looking at becoming a chair, and this may not reflect very highly on me, but my husband said to me, you want to be a chair in the 1980s because you want like your little kingdom that you can make decisions about and that you're like in charge of, right? The
Yeah.
reality of it is like being a chair now, I have visibility on all of these issues that are outside of my purview of control. I can try to influence them, but I can't control them, and I don't have, nor can I have responsibility for them.
Yeah.
But I also feel like if I don't fix some of those problems, I can't effectively do my job and take care of, my team and my department. And so that's what I mean by like, I have had to move and unlearn that trust no one, expect sabotage
Yeah.
to I'm a part of a system and I have to trust, right? Trust, which is the exact opposite of
Yes.
what is beaten into you when you're a trainee. I have to trust that the people around me are going to do their jobs and are going to take care of the problems that that they have responsibility for in a way that then will allow me to be effective. And, that is a struggle that I am still working through every day. And, probably one of my biggest professional challenges that I'm currently working on with my coach.
Wow. Caprice, there's so much to unpack in that. Number one, Jake, your husband, is so funny. God. Yeah, 1980s cheer is a little bit different in many ways. It's true. But you're right. I mean, things that have served us previously, meaning trust no one, right? Double check everything, can be very isolating now and hurt the culture of your team. And I'm also living this very, very much real time as well in that you have to trust your team to build the culture that you want
Yes.
and let
Yeah.
go of that. but that can be really hard. So I'm curious, at what point in your career did that hit you? Like, when did you, because that is such a very wise, insightful acknowledgement. At what point did you actually realize that?
Well, and I think again, like this is such a great example of where coaching helps so much because it was something that I was struggling with but didn't have a name for. Right.
Right.
I couldn't articulate what it was, but it was just like this growing feeling of frustration and anger and ineffectiveness, right?
Yeah.
That like I just couldn't name like why do I feel like I'm so ineffective? And it took, working actually with a couple of different coaches. And I actually went to a leadership course where I really took a couple of days away and really sort of took a deep dive and looked at like, career satisfaction and what is it that is sort of limiting me from really having the happiness and the job satisfaction that I really think I should be having right now.
Yeah.
And it was really spending hours thinking through and trying to articulate. And again, it's getting below the line as we talk about so much, right? Like,
Yes.
what is the mental model that I'm mapping the things that I'm seeing in the outside world onto as I process them with my internal operating system?
Yeah.
And then as I process it, how am I then reflecting myself back out and interacting with and, whether it's through the tone or the facial expressions or the ways that I'm presenting myself or the activities or the things that I'm doing, where is that sort of malalignment, I guess would kind of be the best word.
Man, I'm hearing how much work it took, right? Like internal work, reflective work, leadership training, coaching work to get to the space you have. And I feel like as surgeons, at least for me, I feel emotion I suppress, right? Like I don't want to feel that. I don't want to name it. I just don't want it to be there, right? And so I think just even acknowledging that you were feeling a little bit frustrated and and I hear you being frustrated with yourself because you are so high impact and efficient that when things aren't feeling good, you immediately turn to yourself.
Oh yeah.
And you are leading with action that in order to overcome that, it takes growth and work and reflection.
Yeah. And again, like who has time in the day for that?
I know.
Right. And like as surgeons, we're not really taught to sort of pay attention to our feelings or pay attention to, how we're reacting to things. And, for me, I think people started pointing it out. They're like, hey, you seem really frustrated. You seem really angry, which, is not my default state.
Right.
Right. And so, and it was very clear and it was very clearly and still to some extent has been limiting my effectiveness.
Right.
And again, it comes from, I hate to keep using the word trust again, because it's such a, in some ways, loaded word. But like right now, I think if you read what people are talking about in the leadership world or in, effectiveness in the workplace, like it is all about trust. Trusting the system, trusting the team, trusting yourself, trusting, that things are going to move forward in the way they should if you do your part.
Yes. Right.
Right.
Man, and I'm thinking about the system, like I'm zooming out and I'm thinking about like personal things again of trusting the system. And sometimes your leader doesn't have the power actually to make the action that they want to have. Yeah. And I feel like the higher up you go in the system, like you said, the more you know. Because when you're lower down, you don't know all the things. You just know that things aren't happening. But as you get higher up, you realize that things aren't happening because of X, Y, and Z factors. So my next question for you is, how do you communicate that to your team without giving too much information? Does that make sense when I ask that question?
Yeah. I think that is really the hardest part, right? Yeah. Again, like as you're getting behind the scenes and you're seeing how the sausage is made, right? You're like, ooh, this is making stuff so clear. I really wish I could just tell everyone about this and then they would really understand.
Exactly.
Right? And so it is like, I think transparency is incredibly important. Mm-hmm. I think people use that word to mean different things.
Yeah.
Again, which is individual based on your operating system and what transparency means to you, right? And so for me, I am a very transparent person. I definitely sort of err on the side of disclosure and will pretty much say whatever I think, which again, not the best for your political capital as you move along in your career.
Yeah.
But like then people know where they stand and they know what I'm thinking. And so I do think that that is challenging. And so a lot of times what I will say is I will try to give stroke sort of general statements about what's happening or changes that are coming, or the reason that something that's really wildly unpopular was decided upon. And then I'll try to sort of have a spin that says, from my lens, there are really amazing things happening. And this is why this feels this way now, but I'm confident that this is the direction we're going to go, which again is only effective. And when I say I'm doing that, that's what I'm saying to my department or to, people I'm interacting with. And that only works if they trust you.
Yes.
Right. So again, like it comes back to trust. And that's where, again, I think it can be really hard to be a leader, and where you feel this incredible tension and anger is like you trust that what you see is going to move forward.
Yeah.
You tell people, believe me, come with me. We're going to get there.
Yeah.
And then things that are outside of your control may or may not lead to success for what everybody's trying to accomplish. Right. Yeah. And again, so then you fall back into the trust no one, expect sabotage. And you're like, yep, there it is again. It's all on me. And if I don't come through, it's not going to happen.
Yes.
But the reality of it is like you can't control it. And so you just have to try to figure out how to really make the most of what you can control.
Yep.
Try to influence and try to be able to communicate and articulate the ways that decisions are being made are going to impact things from your perspective.
Yes.
Right?
Yeah, absolutely. And the fact when things feel hard and you're saying, team, you may not know everything right now, but it's going to be okay. That trust, that's you putting in day to day, week to week, month to month, building that bucket of trust, right? Because it takes years to gain the trust. It takes a second to lose it.
Absolutely.
Right? And so you have to keep feeding into that so your team can say, this hurts right now, but I trust you that you have my best interest in your heart, that you're representing me at the table. And at the end of this, it's going to turn out okay. And if it's not okay, you're going to be there with me to make it okay.
Yeah.
Right?
Yeah.
Yeah.
Yeah. And I think, that last piece of what you said, I think is also so critical. Like, one of the things that feels so uncomfortable right now in healthcare, I think, is the rate of change.
Yes.
Right.
Yes.
And in surgery, so much of what we do is kind of irreversible. Right.
Yes.
If you're doing a lap chole and you cut the common bile ducts, you can't uncut it.
You broke it. Yeah.
It's permanent. Right.
Yeah.
And so we are very much like, we make a decision, we definitively do something, and then we're going to live with the consequences of that decision. And I think where we are in healthcare right now, we need to do much more sort of rapid cycle change.
Yeah.
And, again, what you said was, we're going to change. And if it's not okay, you're going to be there with me to change again. Right.
Yes.
And so getting people comfortable with, we can't stay where we are. We've got to do things differently. It may not work. But if it doesn't work, we're not going to be stuck there. We'll be able to change again.
Exactly. And, giving yourself grace with the decisions that you make. Someone said this to me. I wish I could remember who, but they said, you make the best decision you can with the information that you have, right? Maybe it was probably you, Caprice. Let's be honest.
That sounds like something I've said before, actually.
I'm sure you told me that. But it's so true, right? You have to give yourself grace, right? Like in retrospect, right? Monday morning quarterback, like in retrospect, of course, maybe you had made different decisions, but at the time, you did the best that you could. And like you said, being a flexible leader who can pivot is critical at maintaining trust as well.
Yeah. Yeah. And again, like that's where coaching, I think, is so helpful to be able to go back and say, okay, if I had this to do over again, what might I have done differently?
Yes.
And I think a lot of times when you do really intentionally go back and look at the situation, you're like, I made the best decision I could with the information I had at the time.
Right. Exactly.
It turned out to be the right one, but I did the best I could. These were the things that influenced me. Or, right, again, talking about that operating system. Okay, where was my bias? Like, where was my cognitive fixation that like I couldn't see past X, Y, or Z that made me miss this like really obvious key piece of information that I should have taken into account, right? Yes. And then okay, well, my bias is that, it's all my responsibility,
Yep.
right? And if I had it to do over again, boy, I would go back and talk to X, Y, or Z person who is looking at, a different piece of the elephant.
Yes, exactly. And I think that post hoc analysis is critical at making change. But even with my coach, right before you make the decision, it's also nice to have a neutral person who has a different set of experiences and broad lens on the decision you're about to make that can
Mhm.
kind of throw those at you,
Yes,
right? Or
exactly.
remind you of the bias you had 6 months ago.
Exactly,
Yeah.
exactly, and I think that's what, again, like, people sometimes misunderstand about what coaching is.
Yeah.
It's like, "Oh, I don't need coaching, like, I'm at the pinnacle of my career." Well, actually, that's probably where you need coaching the most
Yes.
because nobody else is gonna tell you when you're making a bad decision,
Oh,
right?
yes.
And again, like, what the coach is doing isn't telling you what to do. They're asking questions to try to uncover, again, what are those biases? What are those blind spots? What are those things below the line that are going to lead you down the wrong path? And can you identify them in real time and pivot
Yes.
before, right? You have to
Yes.
start undoing a bunch of stuff.
It's so true. And those conversations I have with my coach, I will sleep on those for nights and nights, right? Like so much work happens outside of the coaching session
For sure.
itself that it's astronomical.
Yeah.
Yeah.
No, absolutely.
I have one more question about trust. I'm thinking about this a lot in that I feel like there's two different ways to view trust in other people from what I've seen. There's this aspect of I will trust you until you do something that's not trustworthy and then you break my trust. And I feel like there's another camp that says you have to build my trust, right? So is this like I'll give you all my trust until you break it, or other people I have to take time to actually have you build the trust before I trust you? Have you thought about those two camps, and do you live in either of those camps?
Yeah, I like that. And I guess I might put a third camp in trust in the way
Yeah.
that I've been talking about it, which isn't necessarily like I don't trust Kara because I don't think that Kara is a good person. It's more of a I don't trust that Kara and I are aligned.
Oh yeah, tell me more.
Right? So
Yeah.
I don't I respect Kara, I respect Kara's point of view, but I think Kara is trying to build something in a way that is a totally different vision than what my vision is of what we're trying to build. And so I don't trust that Kara will make decisions that are aligned with where I'm trying to go. Right?
That
And so
yeah.
that the trust that at least I'm talking about in sort of a work system really is that the leaders are all aligned, right? You can
Yeah.
totally disagree, right?
Yes.
Everybody will have a different opinion about where you should go, but you have to take the time to align and say, this is where we are ultimately going. And we are
Yes.
all going to disagree and then commit and all make decisions that are aligned with the same vision and the same place that we are heading. And so that's where I think trust falls down. And again, it's less about somebody's going to do something because they're sabotaging me. I hate to use that word again, but somebody's doing something
Yeah.
because they don't want me to be successful. Absolutely
Yes.
not. Absolutely
Yes.
not. They're doing something because it is moving forward their vision, which may be in direct conflict or contradict what
Yeah.
your vision is and what you're trying to accomplish. And
Yeah.
so I think talking about trust becomes easier when you take it out of like the individual like core being of who the people are and you talk about it much more in the actions and again sort of below the line like what underlies the actions which is the motivation, all of which are almost always altruistic, appropriate, like good things that you're trying to accomplish.
I'm so happy we dove into that because you're right. I feel like trust is, I mean, that's my identity. Like I am trustworthy as a human being, but I'm also representing a group, right? So sometimes my perspective isn't just Cara King's perspective. It's a perspective of the 10 people that I'm leading, right? And so when you come to the table and if you're misaligned, it takes, I think about the coaching mindset a lot, curiosity, right?
Mhm.
Genuinely trying to understand the motivation so
Yeah.
you can align and taking the personalness out of it. Because when you start feeling personally hit,
Yeah.
like that's when things explode.
Oh yeah.
Right? People
That's
are like sad and
yeah.
hurt. Like we just want to like be curious about different visions and align them. So I think you nailed that.
Yeah. Yeah.
Yeah.
No, I think that's right. And so going back to your original question, which was, does somebody have to earn your trust or do
Yeah.
they have your trust at the outset and then they lose it?
Yeah.
Again, Personally, I really try to come from the latter. Like, I really try to come from a place of assuming positive and good intent.
Yeah.
Um, again, it's not always easy because it depends on how different people, again, present themselves. And
I
right,
know.
like, do you really think that, this person is, again, aligned and
Yeah.
shares your values, right?
Yeah.
Again, like values, are, like everybody's got different values. Like none are better than any others, but are those values aligned? So are you, again, going
Yeah.
to look at the same information and make the same decision because you've committed to the values that have been articulated for your group, for your system,
Yeah.
for your family, for whatever, sort of little ecosystem you're working in for a particular situation.
Yeah. Yeah, I think that assuming good intent is important as a leader, especially because I always want the lens of people are doing the best that they can with the best of intentions. And as soon as if you flip that, I feel like that's when culture breaks down. So
Yes.
I think assuming best intent is really critical for leaders. But then also what we spoke about before, it takes days, weeks, months, years to gain that trust. And the more people show up and show with action that things are aligning, then the deeper it goes. Yeah, I think it's a good point.
Yeah, and I do think, what you said about it takes, a minute or a second to lose the trust that you've built over years.
Yeah.
Um, I do think that that is a place where we have to give our leaders grace,
Grace.
right? And
Yeah.
as a leader, when you do make a decision or do something that harms the group, an individual, the entire system, something, right? Being able to have like the humility and the insight to sort of own that,
Yes.
put words to it,
Yes.
right? Like I did this thing, and then, explain why you did that thing, and then say how you're going to make that thing better,
Yes.
right? Like, but again, it takes a tremendous amount of time and energy and insight that, most of us don't have right now because we're running on the hamster wheel as fast as we can to just try to get through the day.
Survive. Yeah. And it also takes so much vulnerability, right? And I'm thinking, I love what you said, give people grace. We're all humans doing the best that we can. But that also requires us to talk to the person, right? Like, don't assume. It's always unsettling when people may be upset and they're assuming something. They don't actually talk to the individual to
Yeah.
see if that assumption is correct or if, all the things. So
Yeah.
I think grace, vulnerability, and actual like talking to people goes a really long way.
Yeah. No, absolutely.
Yeah.
I was thinking it might be helpful. We've talked a lot about kind of leadership and like coaching in an executive sense. And I do
Yeah.
wonder if it might help us to take a minute and just sort of bring this back to coaching in the operating room.
Yes.
And like why we're talking about this stuff in the setting of the Academy for Surgical Coaching, which is really dedicated to how do we take these kinds of principles and ideas we've been talking about and apply them to the way that you as a surgeon
Yeah.
perform in the operating room to take the best care of the patient you can.
Thanks for bringing us back, Caprice. 1000%. And I think a lot about this when I'm in the OR in regard to the word resilience. I think about that a lot, and like the bandwidth to be able to think in the operating room quickly and efficiently and optimize communication. And when I think about this, I have this slide I'm envisioning right now, almost like a battery scale, right? Like 100% battery. Yeah.
Yep.
And if there's a lot of these things going around in our heads about the things that we're talking about with the leadership component that's taking up so much of our battery, it only leaves X amount, 30%, 20% for bandwidth in the OR, and my resilience goes down.
Yep.
And so what I have found a lot is if I'm not doing the things in the discussion that we've talked about, then in the OR, I am not my best version. I'm shorter, my communication's not as good, I'm not as good of an educator. SIRS reports increase, anger management classes come up on my on my to-do list. I'm exaggerating, but you know what I mean.
No,
right?
you're spot on. Exactly.
Yeah. And so I feel like it's not like this or that. It's like both. Like we are humans that need to be able to manage all of this. So the more that we can thrive in all the ways that we've talked about, the more bandwidth we have in the OR to make those quick decisions, technical, cognitive, stress management, communication, education, all of that, and be the best version of ourselves as a surgeon. What do you think?
Nope, I think that's spot on. And I think the other place, you brought up anger management, but the other place that this comes up, and one of the things that I've seen people focus on a lot when it comes to surgical coaching, is when things aren't going well in the OR.
Yes.
Right. And this is where the concept of the battery or the operating system really comes into play. Like, what is the resilience that you have? What is the capacity that you have to be able to manage the added level of stress that
Yes.
comes in when you're facing a complication, when you're facing bleeding, when the, resident or your assistant may not be exactly who you were hoping you were going to have, and the scrub tech is new, and like all of these things. And so, really, again, where surgical coaching can really help with that is that it can be a really vicious downward spiral, right?
Yeah.
Like things start to go bad, you react badly, the
Yes.
team reacts badly to you, right? It's like this downward spiral, as
Yeah.
opposed to, okay, recognizing, like teaching yourself to recognize the signs that you're starting to get stressed, and
Yes.
then having the ability to mitigate those responses, whether they be physical responses, emotional responses, sort of really unproductive mental loops that you can get into,
Yeah.
yelling, like all of those sort of unproductive things, and having the ability, again, when you have those situations, to after the fact go back and say, okay, how did I not recognize that I was getting worked up? How did I not, get the resources that I needed to manage the situation? And how do I do better in this next time? Right.
Absolutely. And from the coaching role, right? How many of our coachees come to us for quote unquote technical things, right? Like I'm coming here for technical skills, but as soon as you start talking to them, you realize that there's all these other buckets that we actually need to focus on and where they want to focus on, like focus their time in. But it's hard to say those words, identify that, and understand the overlap between that and the technical stuff. So yeah, you're spot on.
Yeah. Yeah. No, I think that's why coaching is so valuable, is because, we have that. And now I'm picturing one of our slides, but we have the slide that has sort of the technical, the cognitive, the interpersonal, right?
Yeah.
And then there's the self-regulation bucket, right? And so,
Yes.
again, like our coaching model just gives you this scaffolding to like have a conversation about how interrelated like all of those different things are, that you have to have the right skill set, but then you have to have the right mindset to be able to deploy that skill set in
Yes.
situations you're facing.
Man, Caprice, you have changed me as a human, as a surgeon, as a mother, as a leader. Like I could go on and on and on. Like you are so important to me. Thank you for being you. Thank you for raising me up since I was a little baby at UW-Madison. Like when we first met, I was like 10 years old, I feel like, at UW-Madison on my first job. And you're this like mecca of a woman, and you still are, but you have just held me so tight. And I just can't thank you enough for everything that you've done, Caprice.
Oh, you're so kind. It's amazing to see what you've accomplished, and more to come for sure.
Oh, I just love you. Thank you so much.
All right.
And if you enjoyed our conversation today, please jump on the Academy for Surgical Coaching website. You can learn there how to become a coach, how to be matched with a coach, and also join us for our Surgical Coaching Summit, which will be this May. And we'd love to see you all and have you there. Thanks so much.